Hi everyone, it's Amy and I'm here to talk to you about medication guidelines today. We want to make sure that all our patients receive their medications and done in a safe manner. As continuous care nurses, we must engage in safe medication practices and contribute to the culture of safety. Monitor the appropriateness of the medication practice by considering the patient, the medication, and the environment. There are many considerations that everyone should take before they actually administer the medication to the patient. For instance, we should always be checking about patient drug allergies, making sure that we're not giving any medications that the patient is allergic to. You might think this sounds a little crazy, but once in a while a doctor may order a medication, like say an antibiotic. It goes to the pharmacy, the pharmacist fills it, and the parent or caregiver goes to pick it up. And the next thing you know, it's in the house. The nurse looks at the medication, checks the drug allergies, and saves the patient from having some type of allergic reaction. This is extremely important. We are the last people to stop a medication that should not be given to our patients before they get it. Expected actions, dose range, side effects of the medication, and any precautions to be taken. So we should know what the medicine is for, what the expected action is going to be. We must make sure that the dose that was ordered is appropriate for that patient, and you should always be evaluating whether the patient has any side effects of the medication. And in certain circumstances, there may be some precautions that have to be taken. You always should consider the developmental stage of the infant, child, or adolescent patient. For instance, a toddler may be running around and not want to stop what they're doing for you to stop and give them their medication. So you might have to be a little bit creative. An adolescent patient may not want to get some of their medications because of the side effects. So educating and encouraging and reassuring is really important for that adolescent patient. A patient's condition or functional status which interferes with their physical capacity to take medications. For example, an NPO status. If they're NPO, we need to make sure that we're following the proper route for the patient's specific needs. A lot of times you'll see we use a syringe and we'll put it through the G-tube, but we must have orders for that and we must be aware of what our patients can or cannot take. We also must consider the child and the family's level of understanding and knowledge of each medication. So this is also an educational opportunity for us nurses. And you can educate the child. A lot of people think, well, they don't understand. But you can also give them a simple explanation, like this medication makes your tummy feel better, or anything that could be creative and that the child will understand. The family definitely should understand why their loved one is getting a certain medication. Competent medication administration is a continual process and goes beyond the simple task of simply giving a medication to a patient. So what this slide is telling you is that we don't just take the medication out of the cabinet, give it to the patient, and say, okay, we're done. It takes a lot more than that and a lot more critical thinking. When you're administering the medication, it now includes ensuring the 10 rites. Yes, there is 10 rites now. A lot of us, when we went to school, it was 5 rites, then we saw 6 rites, we saw 8 rites, now we're seeing 10 rites, and we'll go over those shortly. You also need to make sure that we're preparing the medication correctly. One of the examples I like to use is a simple order for Marilax. If you have an order for Marilax for 17 grams or 1 capful to be given twice a day via G-tube, we are missing the preparation for this medication. We can't just pour the powder down the G-tube. We must have a concentration of either water or some type of fluid to put it in. And even though as nurses we know, for instance, that the 17 grams of Marilax usually goes into 240 cc's of water, tea, juice, we need to make sure that we have a proper order from the doctor stating exactly how much to mix this medication with. Providing the right education and information about the medication. We talked a little bit about this, making sure that the parents and caregivers or child or patient understand why they are getting the medication in the first place. Don't take for granted that the doctor explained it to them. A lot of times in the offices, if the children are upset or things are going awry, they're distracted, the doctor might not take the time to really educate the family about why the medication is being given. When we administer medications, we are always evaluating the outcome of medication on the patient's health status. So this is very important. If you're giving a med continually, day after day, but the medication is not improving or helping the condition, then it might be time to give your case manager, the doctor, and the caregivers a call and discuss what might be a better solution. And of course, as nurses, we must always document the process. So a complete medication order has all of the following components. It must include the date and time the order was written, the medication name, you can use generic or brand, the dosage strength, the dosage form, so we're talking about whether it's a solid, whether it's a syrup, a solution, a concentrate, etc. What is the route of administration? How am I supposed to give this medication, or where is this medication supposed to go? You must have a frequency of administration, and you must have a duration of therapy. If it is a PRN medication, you are required to have an indication for the reason of use. So if you're giving Tylenol, you must have a reason to give it. It usually will say, give Tylenol for fever greater than 100.4 or for discomfort. So if you're giving this medication, it has to be for one of those reasons. We cannot give it for any other reason. I recently did see some documentation that Tylenol was given for agitation. Although agitation might have been caused by discomfort or fever, that is not the purpose or the indication for the reason of use for this medication. You must write for fever or for pain or for whatever the indication actually states in the order. And of course, we always need a signature of a physician or an advanced practice nurse. And in home care, our advanced practice nurses can sign our orders, but we also have to have a co-sign for the physician. So we perform the 10 rites 3 times. This is super important because this is where mistakes can happen. If you do not perform the 10 rites 3 times, you run the risk of giving the patient the wrong medication, the wrong dose. You might give it through the wrong route. But let's go over this. So the first rite is the right patient. That hasn't changed from the first 5. You need the right medication, you need the right dose, you need the right route or site, you need the right time, frequency, you need the right patient, education, you need the right documentation, the right to refuse, you need the right assessment, and the right evaluation. So although that seems like there's a lot to remember there, it's really stuff that we should be doing, and we probably are doing, and you don't even consciously realize it. So when you're talking about doing these 10 rites, I want you to think about when you take the med out of the cabinet or the drawer, and how you would look at the name on the bottle, look at the medication, match it to your MAR, and then you would pour the medication looking at the medication name and the patient, and of course, all of the rites. And then when you're putting the medication away, that 3rd time, you're looking at again to make sure that you have all of the rites down. And then it's safe to give the medication to the patient. Let's see, so the right to refuse. So our patients do have the right to refuse the medication. We can't force anybody to do something that they don't want to do. Sometimes it's not actually the patient that's refusing, but it might be the parent or the caregiver. So when somebody refuses the medication that's ordered by the doctor, we need to find out, why is it that they're refusing it? Maybe it's a matter of not understanding why the med is needed or how important it is to keep certain levels up. So this could be an opportunity for education, and then the caregiver or parent may say, oh yes, I definitely want you to give that medication. If the parent or caregiver continues to refuse the medication even after you've educated them, then what we need to do is call the doctor to let the doctor know the medication was refused. We also need to let the case manager on the case or the on-call supervisor know that you are not able to give the medication because of a refusal. And then you need to document all of this in your note and on the MAR. As far as the right assessment, I think everybody should be is doing this already. So what you would do is you go in, you do your head to toe, you're assessing, to make sure that there's nothing else going on with the patient. For instance, if you walk in and you have a very lethargic patient and you're going to give a medication that can cause some respiratory suppression, we need to think about this. Should I be giving this medication? What's going on with my patient? And I probably need to call the doctor. Not probably, you do. And find out what's going on and whether you should hold the medication. You're also assessing, for instance, if you're going to give a medication through a G-tube, we always need to make sure that we're checking placement before trying to administer the medication. There's nothing worse than trying or attempting to give a medication and finding out that the G-tube is either clogged or it's not in the right place, so you're unable to give the medication. And of course, when things like that happen, then you're wondering, did they get any of the medication, and now what do I do? So assessment is extremely important. Anytime that we're giving a medication, we always evaluate the effects. Is this medication that I'm giving me the effect that I want it to give? If you're giving seizure medications day after day, and yet you're watching your patient have an increase in seizures, then it's time to call the doctor to see if there's either something else going on or if there's something else we need to be doing for them. Like, for instance, if their dosage is off and they need to be reevaluated for a different dose. Sometimes with the seizure medications, their levels aren't okay. And there's other things to think about, especially with kids who have VP shunts. You have to start thinking, is their VP shunt malfunctioning, or what else could be triggering their seizures? But it's very important for us to be performing these 10 rites 3 times, every medication and every time you give them. We always want to make sure that we have the right patient. So in the home, it's quite different than in a facility. Your patients don't necessarily have bracelets on that tell you their name, and a lot of our patients are unable to state their name. But it is extremely important to check the name on the prescription bottle. You never know if when the parent is giving you a bag of medications that there could be other family members' meds in there. You don't want to mix up medications. You want to make sure that the name on the prescription matches your patient. In some houses where we have twins, we have to use 2 identifiers, and a lot of times it's their picture and name over their bed. And if you have any question or any doubt in your head, always ask the caregiver. So we want to make sure that we have the right medication. You're always checking the name of the medication and the expiration date. And the expiration dates seem to go by and expire on us for medications like medications that are in the refrigerator, medications that we don't use as often, so some of our PRNs, some of our nebulized solutions, normal saline for lavage. We need to be checking to be sure that the expiration date is still good before we give the medication. You cannot give an expired medication. So like I said before, you're making sure you have the right medication when you're taking it out of the drawer or cabinet. You're making sure that you have the right medication when you are pouring it, when the medication is being put away or at bedside. So you take your bottle out. I'm taking it out of the cabinet. I'm looking at the label. Yep, this is my patient. This is the medication I need. I'm matching it against my MAR. I still have the right medication. I'm going to take off the top. I'm going to pour my medication. Look at the bottle. Yes, I have the right medication, and then I'm going to put it away. So I know that I have checked it multiple times. And when I'm checking the MAR, I'm checking the entire order. I want to know when it was last given. I want to know the times that it's given to be sure that I am giving it the right time. So we want to confirm the dose. To ensure the correct dosage, we have to calculate. If you're having any issues with calculating any of your dosages, call your case manager or supervisor on call. We'll be happy to check the dose for you. The right route. Check the order and appropriateness of the route on the order as well as the prescription label. Confirm that the patient can take or receive the medication by the ordered route. So this is very important because sometimes the routes get changed from when the doctor writes the order to the pharmacy and then when that gets home for you to give. So a lot of times our doctors will just automatically write PO even though the person takes their meds by G-tube. It is up to the nurse to clarify this. All we need to do is call the ordering doctor, clarify it, say, I'm pretty sure this medication was supposed to be given by G-tube, but it's written PO. Can you clarify for this? My patient is NPO, has dysphagia. We give all the meds through the G-tube, and you have to write out a clarifying order before you can give it. Make sure that you are giving the medication at the right time. So check the frequency of the prescribed medication. Double check that you are giving the medication that's prescribed at the correct time. Confirm when the last dose was given. And this is very important because we have a lot of medications that say give every 12 hours, twice a day, which should be spread out 12 hours, or every 8 hours. So you need to make sure that if the caregiver or the last nurse, if there was some reason why the medicine was given late, you may have to confirm if it's okay to give it as soon as you're planning on it. So the right education we talked a little bit about. You're checking if the caregiver or patient understands what the medication is for. You want to be sure that you're doing the right documentation. Be sure you've signed the medication on the MAR after it has been administered. Ensure the medication is prescribed correctly with a start and end date if appropriate. So definitely, after you give your medications, you want to go to that MAR and you want to sign off that you gave them. This is super important for the next oncoming nurse. If they come in, they may have a question if they see a blank if the medication was really given or not. So please make sure and double check before you leave your shift that you have signed off on all the medications that you have administered. Ensure the medication is prescribed correctly with a start and end date if appropriate. If you get a medication like an antibiotic or you get a medication like prednisone and it states a certain amount of days, it's very important that the order shows that, so the medication is not given beyond that date. We talked a little bit about the right to refuse, so you're going to ensure you have the caregiver patient consent to administer medications. You don't force medications on anybody. Be aware that caregivers or patients do have the right to refuse the medication. This must be documented and reported to their case manager or on-call supervisor and the patient's physician. And don't forget, it might be as simple as educating the parent or caregiver or patient. Making sure that you do your right assessment. Check that your patient actually needs the medication. So it has happened in certain circumstances where a medication got ordered for a patient and it was the wrong patient. They shouldn't have that medication. It doesn't make sense to give that medication. So be sure that there is a reason for your patient to have the medication that is ordered. Check for contradictions. And you should always have baseline observations before giving a medication. The right evaluation. Ensure that your medication is working the way it should. Ensure the medications are reviewed every shift. An ongoing observation of medication effects every time the medication is administered. Safe medication steps. Be vigilant when preparing medications. Avoid distractions if possible, and clarify any questions related to the safe steps of medication administration. So avoiding distractions is a little more difficult in the home. When you're in a facility, there's usually a medication room where you can go in and you can tell the nurse next to you to stop talking to you. You want to make sure that you're preparing the medications correctly and you don't want to make any mistakes. In the home, it might be a little bit harder just because you're in a circumstance where you might be preparing the meds in the kitchen, the TV could be loud, there could be kids running around, dogs barking. So it's best if you can avoid any distractions if possible. You can politely ask somebody to just give you a moment of peace and quiet to prepare your medications, and then you can answer any of their questions or talk to them and conversate with them after. I hope this helped. I will be doing another video on MARS and TARS so that we make sure that we know how to document correctly on our medication administration record. So thank you.